She went back in her room or straight in here? Straight in here or in her room?
Okay. Go ahead. The Honorable Mayor Motley, Prime Minister of Barbados, High Commission of Canada, Ms. Jessica Mackey, Senior Social Policy Officer, Ms. Elizabeth Riley, Acting Director, Caribbean Disaster Management Agency, CDMA, Executive Director of CARFA, Dr. Joy St. Jones, invited guests, media, good afternoon to you all, and it gives me a great pleasure and honor to be with you this afternoon and extend heartfelt greetings on behalf of our Director General of World Health Organization, Dr. Tedros Adhanom Ghebreyesus, and then our Director of PAHO, Dr. Carissa Etienne. Madam Prime Minister, the COVID-19 pandemic continues to accelerate with over 15 million people and 15 million persons and cases with 630,000 deaths reported to WHO globally. The pandemic has already changed the way we live our lives. Part of adjusting to the new normal is finding a way to live our lives safely. That's what the Director General mentioned. Barbados and the Eastern Caribbean countries have shown that with sustained political leadership and action backed by community and people's support, the COVID-19 can be suppressed no matter the stage and transmission phase. As you have illustrated in many global fora, moral leadership, prioritizing of vulnerable population, whole of government and whole of society approach are among the key principles to fight this virus. Everyone has a role to play in fighting this epidemic. Each person must equip themselves with the right information and use it, assess risk, and make the best decision to protect themselves and their communities. We are committed to collaborate with the national governments, leaders, health authorities, and development partners to remain vigilant in the face of the persistent threat of the COVID pose during the recovery phase and beyond. Honorable Prime Minister, this donation of COVID-19 essential medical supplies, PPEs, to the Caribbean countries from WHO through your advocacy efforts is truly remarkable and exemplary. We recognize some of the particular challenges of the small island development states. In the face of this challenge, Caribbean leaders, such as yourself, have taken extraordinary measures to ensure the health of their countries' population, to protect healthcare workers and others. Your advocacy continues to show tangible results, including the delivery of these PPEs. The coordination for this donation is made possible via the UN COVID-19 supply chain system, with the delivery and the logistic support of the Government of Canada, the UN World Food Programme for its delivery, with the contribution of the Jack Ma Foundation. This contribution demonstrates the ongoing support to this response from the private sector, and the development of this partnership plays an essential role and achieve results to protecting many. This delivery is part of the larger global efforts to respond to ongoing urgent needs, including the needs of the Americas, CARICOM countries, small island development states. Indeed, these efforts highlight the significance of solidarity and partnership, leadership, regional coordination mechanism, CARICOM institutions, and the global partners and PAHO and WHO. Economic recovery in many Caribbean countries depends also on the restoration of tourist arrivals, linked to the reopening of borders, investing in COVID-19 sustainable prevention and suppression for detection, management of cases at points of entry. Madam Prime Minister, currently, we need to succeed in what we started to control the potential transmission of COVID-19 in the reopening of borders. We need to support to update recommendations. Madam Prime Minister, ladies and gentlemen, Currently, over 165 candidate vaccines are at some stage of development. Of these 25 vaccines candidates in human trials, we know at least 3 or 4 going into phase 3 trials. Barbados, most of Eastern Caribbean countries, alongside 75 countries, submitted expression of interest in the facility for vaccines, joining another 90 countries that could be supported through these mechanisms. WHO is developing global allocation framework, which you advocated for vaccines, PPEs, medicines. Member states are continuing to work. At the end of August 2021, at least 1 in 5 Caribbean, including Barbadian, could be vaccinated with a new COVID-19 vaccine. We will see that day soon to be. Our technical cooperation will continue to save lives, protect health workers, and stop the spread of COVID-19 to mitigate the social and economic impact. Madam Prime Minister, this donation, which also covers other countries in the Americas, Bolivia, Cuba, Dominican Republic, Ecuador, Grenada, Guatemala, Haiti, Honduras, Jamaica, Nicaragua, Paraguay, have over 26 million PPE kits and then N95 masks. With this, we continue to collaborate and save lives. I thank you very much for your leadership. Thank you.
Okay.
Somebody needs to invite people up. Who's speaking up?
There you go.
Thank you.
Jessica Mackey, right?
Yes,
Political officer.
yes.
Jessica Mackey from
Jessica Mackey,
the
Senior Political Advisor.
Canadian Division.
That's right. Okay. All right. All set. The Honourable Prime Minister Mia Amor-Motley, other distinguished partners and guests, good afternoon. It is a pleasure to be here. Unfortunately, the High Commissioner of Canada to Barbados and the Eastern Caribbean, Her Excellency Marie Legault, could not be here with us today, but she sends her regards to all. Canada is very proud to be providing airlift support in response to the humanitarian community's request for the transport of critical medical supplies in response to the COVID-19 pandemic. The Canadian Armed Forces are operating out of a humanitarian logistical hub at Panama Pacifico Airport. This deployment is called Operation Globe, and it is aimed at utilizing military assets to facilitate the movement of critical supplies given unprecedented supply chain disruptions. Canada is proud to contribute in a meaningful way to ensure that medical and humanitarian supplies get to where they are most needed. Working alongside our regional partners and allies, the Canadian Armed Forces continue to successfully conduct operations around the world. This operation is an excellent example of collaboration between our countries and global solidarity. Canada congratulates all of our partners involved on their collaboration and reaching this point of delivery. I would like to take this opportunity to thank Prime Minister Motley and the Government of Barbados for facilitating the establishment of this regional hub. We wish all of our partners great success in the rollout of these very important supplies as we work together to leave no one behind during this unprecedented global crisis. Thank you very much.
Following speech will be by Wendy, who's the Executive Director, the acting Executive Director of CARICOM.
The Honourable Prime Minister, Mia Amor-Motley, distinguished guests. Today I wish to speak to 3 things. First, thankfulness that none of our SEDIMA participating states has been adversely affected by Tropical Storm Gonzalo. A continued posture of readiness is essential as we navigate the remainder of the hurricane season. The reality is that we will be coexisting with COVID-19 for some time. Gonzalo, I believe, gave us an opportunity to test our enhanced operational arrangements in this complex environment. Let us learn and be better prepared the next time. Second, I wish to speak about vision. The Integrated Regional Logistics Hub is part of the vision of the enhanced services that the regional response mechanism will deliver to our participating states going forward. The hub serves as a transshipment point for COVID-19 related supplies and will aid in the coordination of humanitarian logistics. Whilst the establishment of the hub is linked to the COVID-19 response, it will be available throughout the 2020 Atlantic hurricane season and possibly beyond as a legacy facility. Maritime operations for the hub are based at the Barbados port, and air operations are based here at the Grantley Adams International Airport. The items donated by WHO and the JACMA Foundation are scheduled to be delivered to 20 CARICOM countries over the next 2 weeks. Delivery to 14 countries will be via the Barbados Hub, and to 6 countries through our partnership with the World Food Program through their hub in Panama. All items delivered by the hub are consigned to our national disaster coordinators, given their role as coordinator of national disaster mechanisms. And I want to thank Ms. Carrie Hines for being with us today. The third area is about partnership. The reality is that we can accomplish so much more working together than working apart. By virtue of the multi-hazard environment that we exist in, we in the Caribbean know firsthand what it means to live with risk, and we also know that resilience is our point of departure. I stated just last week that COVID-19 has brought to the fore the realities associated with transboundary threats and demonstrated the regional solidarity and cooperation that was envisaged by the authors of the revised Treaty of Chaguaramas. I wish to take this opportunity to thank you, Prime Minister Motley, for your regional leadership in your capacity as chair of CARICOM during the first few months of the COVID-19 pandemic, and also for the staunch support of the Government of Barbados, one of our sub-regional focal points, in facilitating the establishment and operations of the hub. I wish to acknowledge the role of the CARICOM Secretariat and members of the CARICOM Security Cluster, CARFA, the Regional Security System, and CARICOM Impacts, whose leadership is with us today, and thank you very much for coming. CDEMA values our sister institutions, and I thank my colleagues for being here. Public thanks must go to the CDEMA Coordinating Unit team. I have the privilege of working with dedicated men and women who, as I speak, are on the outside ensuring that this donation makes its way to our countries in an efficient and timely manner. Special mention must, of course, be made to PAHO WHO. Mr. Paul Molinaro, Head of Procurement at the World Health Organization, and his team worked with us over the past several weeks to bring this to fruition. Thank you also to the World Food Program, represented today by Mr. Regis Chapman, who made a commitment in 2017 after Hurricanes Irma and Maria to work with CDEMA in strengthening our logistics capacity. You have delivered, Regis, and you continue to deliver. Thank you very much. In closing, I wish to thank the Government of Canada. CDEMA has a long-standing history of partnership with Canada since the establishment of CDERA back in the 1990s. Canadian $401,359 has been reallocated from the Targeted Support to CDEMA project towards the establishment and operations of the hub, and will also support the onward distribution of the WHO JACMA donation. Thank you very much.
Future statement will now be given by the Honorable Mia Motley, Prime Minister of Barbados.
Thank you. You're welcome. Thank you very much, everyone, distinguished guests all. Let me start from the bridge of the last speaker, because you gave a perfect vote of thanks of bringing together all of the persons and parties who are responsible for us standing here today. And I really want to start off by saying that on behalf of the Caribbean community, on behalf of the chairman of CARICOM, who is obviously now the Prime Minister of St. Vincent and the Grenadines, I am more than happy to accept this gift today from the World Health Organization in partnership with the Jack Ma Foundation, in partnership with the others who helped to make it happen, the Canadian government through its military for helping us with the transport, the World Food Programme for helping to coordinate delivery not just here but elsewhere, and of course the tried and tested day-to-day partners of this region, specifically SEDIMA, CARFA, the RSS, and IMPACTS, those of you who make our lives possible. And I say so conscious that we see a lot of things happening in the region, but we don't quite sometimes appreciate how they happen. And these regional institutions, SEDIMA, CARFA, IMPACTS and the JRCC, and the regional security system, many people take it for granted, but the truth is, these have been the institutions, I can say without fear of contradiction, that have allowed the countries of the Caribbean community, not just the independent countries, but the associated member states as well, to be able to get through the last 7 months since this coronavirus pandemic has been threatening the global community. And the theme of Ms. Riley, with the partnership, with the vision, and with the most important act, giving thanks, gratitude, are those that I would wish to adopt as my own today, largely because about 2 months ago, on a Sunday like today, in a WhatsApp to Dr. Tedros, in the middle of the day, probably around the same time, we agreed that we needed to speak urgently because of the market failures from which the region was suffering, like other members of the global community. The difference is that on every single occasion that we have reached out to the WHO, to PAHO, and to CARFA, I can say once again without fear of contradiction that they have been there for the Caribbean community during this pandemic. And I make this point because everything else in the conduct of commerce, in the strategic allocation of resources, has been against small states, and it has appeared as though the mighty and the strongest shall be only those who will survive. Were it not for these agencies, that would be our fate. And I therefore start at this point because in today's world, many people repudiate multilateralism and cooperation. But we stand here today as a result of our commitment that by working together in partnership through the institutions that have been established so to do, but also across institutions and across sovereign states, that partnership has made the difference to our ability to respond to what will come to be regarded as the most significant disruption of global society and the global economy in certainly probably a century. I say so conscious that even though World War II and World War I were there, that even they were not able, those two wars were not able to reach every single country on earth. But regrettably, this pandemic is showing itself as being able to reach every single corner of the earth. I also want to thank, as I said, the WHO for being responsive, but for going beyond that. Because what you see today is but only one example of that generous commitment to work on behalf of smaller states through this donation. But we've also benefited as a result, and you've heard me speak about it before, the establishment of the African Medical Supplies Platform, which was as a result of both the WHO and members of the UN putting us in partnership with our colleague governments in Africa in order to ensure that we have access to all aspects of the in vitro diagnostics, from the testing kits to the same PPE and other masks and other things that we're getting today, ultimately to the therapeutics, and also, as you heard earlier, potentially also to a vaccine. And what is important is that we not only have access, which we didn't as a small region, as CARICOM on our own, but that we are also looking to be able to procure at prices that are usually only available for much larger countries and populations. And therefore, a St. Kitts with 40,000 people will have the same access as a Nigeria with 200 million people. And that is the fundamental policy space that we've negotiated to make a difference to the people of the region. For some people, it may sound academic and airy-fairy, but this makes the difference to who gets drugs. This makes the difference to who will get a vaccine. This makes the difference to the frontline workers, not just the nurses and the doctors and the lab technicians, but also those who are working as police, those who are working in immigration, those who are working in port health, those who are working in customs, those who are customs guards. Because at the end of the day, what we have learned, those who are working in supermarkets, what we have learned is that it takes a whole army of us across a range of disciplines to be able to ensure that we can protect our people and equally protect those who come to visit us. And as it relates, and that, as it relates to your speech, was part of the vision to ensure that size or geography should not handicap the Caribbean community in the fight against this virus. And simply, thank you. There's no two other words for thank you that song better than thank you. And I say that conscious that we've had to say thank you to a number of people recently. I want to thank and use this opportunity without prejudice to all of you here. On Thursday, my Minister of Foreign Affairs attended the airport to receive another generous gift from the government of the United Arab Emirates. And I want to thank them in particular, not just for the gift that they've sent in for, like today, for the entire regional community with PPE and other critical areas. I'm also aware of the other things that they have done with us deep, deep, deep in the months of April and May, when nobody was taking calls, when nobody was helping anybody. These are the friends that I shall forever remember as friends of the Caribbean community, because they were there for us, like yourself, like your institutions, when we most needed it. And of course, the Caribbean Development Bank, I believe, also has been a critical entity in this entire equation. So my friends, today is Sunday. I do not want to keep any of you much longer, but suffice it to say that on behalf of a grateful region, not just country, that we believe that this adds value for us to be able, first, to protect our frontline workers, second, to be, and those frontline workers range the entire gamut I've just described. Secondly, for us to thank our partners and our sovereign alliances that we have. Canada has been that friend for the Caribbean for more than a century. In fact, it is ironic that in this year of our Lord, we continue to celebrate the presence of Canadian private sector entities who have been here for over a century as well. And to that extent, that tells the story of how we are family, in the words of Machel and Skinny, Fabulous, and Bunji, that we are family. And to the World Food Programme, you more than any other entity understand the mechanics and logistics of distribution. It is not easy. I say in these things sometimes the promise of relief creates more divisions sometimes than we bargain for. And therefore, I'm conscious that you work in a very difficult environment. And to that extent, your ability to be able to take some of the costs that would otherwise have to be borne by CARICOM governments who themselves are facing significant reductions in revenue, increased expenditure. These are the things for which we say thank you today, and we commit ourselves to continuing to work with you. I'm told that the next shipment will equally have also more testing kits, which will, and that for us has been a major issue, the PCR kits. We've, as a country, Barbados has remained committed to what we call the gold standard, but it has consequences. It means, and we're here at the airport, that there is a lag time between when you are swabbed and when you get back the results. But the race is not for the swift, but for those who endure. And we believe that holding to that gold standard allows us to have a better level of protection for our citizens and for our workers than simply moving to other rapid tests that have not been validated either by the relevant bodies or indeed by the regional entities. So my friends, thank you very much, and I look forward to us being able, in the words of my Minister of Health, that we can appropriately reflect when this moment in time is over, that there was no surrender, that there was no retreat, not just on the part of us in Barbados, but on the part of us in the wider Caribbean. And that we also use this as a moment to fight some long-fought battles that were regrettably still standing. The notion that we can continue to use definitions and criteria that are inappropriate to determine access to in vitro diagnostics, whether that criteria is maternal mortality or whether that criteria is historic per capita income, they are both inappropriate for us to be able to determine what small states such as ours should be allowed to be able to access in terms of either funding or pricing or access as we fight a pandemic. The mere fact that the global community even accepts that this is not a time for austerity, that this is not a time for division, but that in the words of the WHO, this is a time for solidarity, tells us all that we need to know, that we are always stronger together. Thank you, and God bless.